The fact that I am a phacocanaloplasty and a canaloplasty surgeon has helped increase my surgical volume. I'm a fairly busy referral-based glaucoma surgeon as it is. However, I'd say I have about a 25% increase in my surgical glaucoma volume from this procedure.
I was a fairly busy glaucoma surgeon prior to the advent or the introduction of canaloplasty in my practice. With canaloplasty as one of my options, I find I'm doing more glaucoma surgery. What happens is you expand the patient population who you can address surgically because it's safer. And without question, you feel comfortable recommending the procedure. And if that's one of the things I like to reflect on, is how I felt emotionally when I would recommend a trabeculectomy to the patient versus how I feel when I recommend a canaloplasty. It really is telling. When I recommended trabeculectomy, I always had a sense of foreboding, I suppose, because I knew that there was a chance of a significant problem. Now, when I recommend a canaloplasty, I'm excited. I know the patients are going to do well, and if they don't, again, they have options. We're not at a dead end. So I feel like canaloplasty has expanded my practice dramatically. It's allowed me to intervene earlier, and I think early intervention is the key. And we know that from the studies that early intervention is better treatment. So if we can get in there earlier and relieve the pressure, reduce dependence on medications, we're really providing a great service to the patients.
Prior to canaloplasty, we had a fairly regular schedule of trabeculectomy, ECP, shunting. More recently, with my intervention with offering canaloplasty to my patients, we've seen a rapid transition to a lot of the surgery, the glaucoma management, into canaloplasty. And there's, I think, several factors. One is I feel more comfortable doing this, and the learning curve has been very easy for me to adapt to. But secondarily, I think patient outcomes have been very positive. And knowing that the patients are having great success with the therapy and they're requesting it, I think that's the biggest surprise. Is patients who've had one eye with canaloplasty are very comfortable and would insist on doing canaloplasty in the fellow eye. And I think that's been the #1 driver for us to do more of these in the future.
Canaloplasty and me as a glaucoma specialist being able to offer that surgery has helped my practice. I've gotten a lot more referrals for specifically for this procedure because I offer it, and this comes from several different sources. It's referred from optometrists, ophthalmologists, sometimes quite a ways away where I normally wouldn't have seen those patients. Now that I'm one of the centers that offers this service, it definitely has increased some of my surgical volume.
As far as my practice growth, which I can attribute to canaloplasty, that was another surprise. I figured that I might have a couple of % growth just from having another procedure, but it turned out to be far greater than that. The growth that I attribute to canaloplasty, looking at year-over-year revenue, is actually 20% in my first year of performing canaloplasty. Now, if I look at the actual revenue generated from the surgery itself, that's not 20% of my practice. So clearly there has been a bit of a halo effect, and I do now see patients who come to my practice who have heard about my performing canaloplasty, but might have other conditions in addition to glaucoma that need to be treated. So it's in general, it's been a practice builder, and that was a surprise.